I'm absolutely honored to participate in the 2023 LiveLoveLaugh Lecture series. And as someone who is deeply engaged with global healthcare, I am keenly aware of the enormous neglect of mental health, which I believe is so vital for our collective well-being. Whilst we spend billions of dollars managing non-communicable diseases like diabetes, cancer, autoimmune and cardiovascular disease, I'm afraid mental illness is badly ignored. Efforts to understand and treat mental illness from the lens of medical science have been both inadequate and underfunded. And these approaches have caused incalculable damage to human potential over the ages. Thankfully, the landscape is changing. We have seen a shift because of the consistent efforts of many amazing mental health organizations, academic institutions, and courageous voices like Deepika's. Today, we have a better understanding of mental well-being. And yet, despite these strides, people with mental health issues are still ostracized and feel alone. In fact, the Lancet Psychiatry estimated in 2017 that nearly 200 million people, that is 1 in every 7 Indian, had mental disorders. Mind you, this estimate was made before the impact of the COVID-19 pandemic on people's mental health. To address this, India needs to take urgent action. Mental health care must be made available and affordable to everyone. Prevention of mental illness and early intervention are critical. Every primary healthcare center and district hospital ought to have dedicated mental health staff. Universal health coverage should encompass therapy and medication. Increased investments and sustained collaborative efforts are the way forward. Despite India's massive mental illness challenge, budgetary allocation for mental health remains, I'm afraid, very poor. And this gap presents an opportunity for philanthropy to catalyze change. My own commitment to mental health as a part of the Giving Pledge has helped me understand the profound societal impact mental health funding delivers. When people with mental health issues receive support and are reintegrated into society, the result is transformative, not only for themselves, but also for their societies and the country. Investments in mental health are investments in our nation's future. So to sum up, mental health is our shared and collective responsibility. Allocating resources to mental health illustrates a commitment to inclusive growth and lies at the very core of building a stronger and more confident nation. So let's journey together towards a mentally healthier India.